You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Are you unhappy with your appearance? Do you look tired? On today's program, we have Newport Beach's most popular cosmetic surgeon. Today's topic, the latest advancements in cosmetic surgery. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the latest advancements in cosmetic surgery. My first guest is Newport Beach cosmetic surgeon, Dr. Michael Elam. Dr. Elam, welcome to the program.
Thanks, Randy.
And how long have you been doing cosmetic surgery?
Almost 30 years. I started actually in 1976. I finally moved to California in 1979, and I've been in offices in Newport Beach since 1980.
Now, you were one of the first guys to bring liposuction to this country, is that right?
Yeah, actually 1981, and I studied under Dr. Alous and Dr. Fournier in Paris, France, and came back and started doing the operation immediately, and formed the American Society of Liposuction Surgery in those years.
Is that right?
Yes, and I was really the past president in 1984 and 1985.
You still do a lot of liposuction?
I still do a lot of liposuction. It's one of my favorite operations.
Now, we've invited you on the program today to talk about what's new in cosmetic surgery, specifically face. We'll talk a little bit about lipo later. Mm-hmm. And I will tell you, I interview physicians nationwide, and I try not to endorse any of the doctors on the show. I'm just asking the questions, as I say, but I will tell you, these are the best photos, or they are the best photos I've ever seen, the best before and afters.
Well, I think, the thing about cosmetic surgery is this. Cosmetic surgery has really become of age. With all the TV programs that talk about cosmetic surgery, all the shows that show cosmetic surgery, cosmetic surgery, Randy, is not just for the rich and famous anymore. Cosmetic surgery can help a lot of people, and it helps a lot of people with their self-esteem, their appearance, and helps them through life. And
it's become more mainstream, and it's very popular now, right?
In some instances, it's really a life-changing experience for patients. And I got some good examples to show you, some interesting patients, interesting stories.
Okay, now before we get into the specifics of the keys to a natural-looking facelift and things like that, your background, your training.
Well, I trained at Charity Hospital in New Orleans. I spent 7 years as a resident there, and when I came out, I was in practice with a very famous cosmetic surgeon, learned from really one of the best, and was an apprentice in my early years. And gradually, as the specialty improved, the techniques improved, I embraced a lot of the new technology, liposuction being one of them, facial rejuvenation, endoscopic surgery, and really I've evolved over the years. And I can tell you now that surgery now and cosmetic surgery in general is much better than the early years.
Is it that much better? 20 years?
Oh, it's much
later?
More predictable. The results are better. The patients are happier, and the taboo surrounding cosmetic surgery in the early years no longer exists. I mean, a lot of that has to do with Phyllis Diller and the popularity that
you did Phyllis Diller's.
I did Phyllis
one
Diller.
Or two facelifts for her.
I did 2 facelifts on her, and it really helped bring cosmetic surgery to the forefront. And all the new shows and these extreme makeover programs have really endorsed cosmetic surgery and really brought it out of the shadows.
Now, for people that don't know you, you're one of the most. I mean, you're one of the busiest guys in anywhere in this business, and you were, in fact, I think, on Lifestyles of the Rich and Famous. I mean, you have a big Hollywood following as well.
Well, I do, but I limit what I do because I realize that you have to have balance in life, just like you have to have balance in surgery.
Now, back to what's changed. I mean, what specifically has changed in the last 20 years that makes, for a better result?
Well, I think the most important innovation in surgery in general, I mean, we're talking about heart surgery, belly surgery, lung surgery, any type of surgery, has been the use of the endoscope. The endoscope and the endoscopic techniques involve small incisions, so we can do the same operation through a tiny incision. We can take out your appendix for a little bitty incision. And in facelift surgery, you can do a lot of the facial rejuvenation procedures that required big incisions, large scars, prolonged healing time through small, tiny incisions.
Now, you're one of the guys, by the way, very, very interesting. I mean, that you truly believe, we've talked a lot off camera, that you're changing lives, that their personalities change.
I mean, that's the most rewarding thing about what I do. And, I see it every day. And
people become more outgoing, more confident.
I mean, that's the reason why I do what I do, really. Because I can see a life-changing experience in a lot of patients that come in. I mean, even young people, old people, everybody. I think that gets a successful result has some degree of increased self-esteem. In the workplace today, older people are being replaced by younger people every day. And I think the most common reason why we do facial rejuvenation or facelift operations in patients are they work, they have a job, they have a career. And it's kind of like wearing a nice suit, driving a nice car. It's an appearance improving issue that most people have to face when they get to be 45 or 50. They want to look and feel young.
Let's start with the patient goes into you. take me through the process. I mean, how do you look at the face? What seems to age first?
Well, there's two types of aging. There's the chronological age, which is the number that you put on the age, and there's the physiologic age, and that's the miles on the odometer. And the most useful technique that we have in our office is a computer, an imaging computer. And what we do is we take a photograph of the person, and we basically look at the photograph from different angles, and we show it to the patient. And we talk about what changes they want to make and what things they don't like about themselves. And then we're able to morph that photograph and actually do the changes on the picture.
Is that pretty accurate?
It really is accurate. You know, we don't overdo it. We don't oversell it. We use it as an index of what can be done. There's no guarantee or no warranty associated with it, but in general, I do better than the image machine does.
So what subtle changes make the biggest? Let's start with the eyes. What are you doing for the eyes?
Well, I think the most important thing about the eyes is most patients who come in and want their eyes done really traditionally need a brow lift. Let me show you a couple of photos I brought today, Randy, and I'll show you what I'm talking about. This is a good example of the youngest patient that we see in cosmetic surgery. This is a young girl that was brought in by her mom because she had protruding ears. And usually what happens around 6 or 7 years of age, these little girls or little boys get teased by their peers. This girl was having a lot of trouble in school. She was being teased by her peers. She was doing poorly in her grades. And she brought her in to have her ears pinned. And this is about the age that we do this.
And that's an easy procedure.
It's a relatively easy procedure, and it changes this little girl tremendously. This little girl is now a straight A student. She's very popular. And I mean, would she have been that way anyway? Well, maybe so, but this really helped her.
Let's take a look at a few more.
Let me show you a really good example of what I'm talking about when I talk about endoscopic surgery and I talk about brow lift operations.
Okay.
This young lady comes in, she's about 45 years old, and people tell her she looks tired, she looks sad, she looks angry. And her eyes are kind of baggy, and she just doesn't feel good about herself. This is what we call a scarless facelift. By making tiny incisions in this patient's forehead and doing a little surgery around the eyes, we can rejuvenate this person and make them look much younger, much better. And the operation has minimal downtime.
Now, when I look at the before and after, she had bags.
Right. Well, we take the fat out. We take the fat out from around the eyes, from the inside of the eye, without an external incision, and we lift the brow and reposition the cheekbones, and that's the key to it.
So this woman, brow lift,
lower lid blepharoplasty,
okay,
and mid-face suspension.
What about her neck? She had a good neck to begin with.
She has a good neck. She's young enough to where she doesn't need a facelift.
And that's a big difference.
Big, big difference. And this is an operation that doesn't need to be repeated. Let me show you another example of what I'm talking about. This is a young lady that comes into me, doesn't feel very good about herself. Okay, now take a look at this before picture, Randy. This young lady comes into me. She's about 42 years old. She just had a baby. She's lost a lot of weight after her baby. She doesn't feel good about herself. Her friends tell her, look, she looks tired, she looks angry, she doesn't look happy. And
got kind of a tough face there.
Tough face. And the reason why is she's lost a lot of fat in her face, her brows have fallen down, her nose is too prominent. So what I did with her is I lifted her brows, I did her eyes, I put some fat back in her face.
When you said did her eyes, what did you do?
Well, I did an upper lid blepharoplasty.
When you say blepharoplasty, what are we talking about?
Well, I mean, take a look at her eyes, Randy. Look at her brows. Her brows are really low. Her eyes are a little bit sallow, and she looks sad.
So the heavy skin over her eyes is...
Well, that's extra fat, extra skin, and extra muscle.
Okay.
So what we do is we elevate the brow first and reposition the brow, and then we take out any redundant skin that's above the eyelids, and we take out the fat from below the eyelids. And in the elevation of the cheek and repositioning of the fat into the face, and a rhinoplasty altogether make the big difference in this patient. I mean, Randy, take a look at this after.
Yeah.
I mean, a dramatic difference.
You know, I hate to say, I mean, she's pretty now. Where before she was just plain.
Yeah. I mean, we call her Holly Berry in the office.
Is that right?
Every time she comes in, because she's very attractive now.
What does she say, by the way? Because this is a great result.
Oh, well, I mean, she's walking on a cloud when she walks in.
How does somebody like this life change?
Well, I think it makes them feel so much better about themselves. I mean, you know, it's rough sometimes when women have babies and they go through that type of a change in their life. I mean, their life changes and they still want to feel pretty. They still want to, you know, feel good about themselves. And I mean, you know, I think the adjustment would occur without this, but this really makes it much better for the patient.
Now, she looks very natural. If I saw her, it doesn't look like she's had anything done. And probably 5 to 10 years younger.
Really? Yeah, I think so too. Now, Randy, here's another example of the same type of patient. This lady comes into me, she's 46 years old. I mean, look at the before. She's got a prominent nose, she's got a kind of a drooping brow, and she looks a little sad. She looks sallow in this photograph. And I mean,
she's a pretty girl. I mean, what bothered her in particular?
She has pretty features. I mean, she didn't like her nose, it was too prominent. She just felt like she was getting old. Okay. That's what bothered her. And so when people come in, we put them on the computer and we show them what we can do to make them look younger. And I mean, look at the after in this photograph.
Yeah,
you see the difference. I mean, this woman looks like a young, attractive woman again.
Yes, and very sophisticated look as well.
And I get so excited when I see a person like this because I can see what I can do. It's like a canvas that comes in, I can change. And I mean, these types of patients truly excite me.
Are there some patients that they come to you and you just go, oh, this is going to be great?
I mean, when she walked in the door, I mean, all I could do was think about, you know, how I could help this person. I mean, because you know that all the characteristics are there. She has a nice, strong jaw. She has good, high cheekbones. She has pretty eyes. And it's just a question of putting everything together.
Now, her nose. I mean, what did you do to her nose?
Well, I took the bump off her
subtle.
nose. And that was the main thing. I mean, in the nose, I mean, I brought some great examples of rhinoplasty surgery because rhinoplasties, and I'll show you what I'm talking about. And a rhinoplasty is probably the most difficult operation in cosmetic surgery.
Is that right?
Well,
the nose.
The nose is the most characteristic feature of the face. And the reason why a rhinoplasty is so difficult is that you're making a change in a person's looks that everyone can see. A rhinoplasty or a nose job is really the first operation in cosmetic surgery. 5,000 years ago, the Egyptians were doing rhinoplasties. I mean, that's how far it goes back. And it's the most characteristic feature of the face. And if you look at this example, this is a good example of a very attractive girl with a large, prominent nose. And we judge a nose in two parameters, size and shape. And in this situation, her nose is too big and the shape is not right. And what a difference it makes. I mean, look at the after photograph.
Looks good. Now, you like doing noses.
I really do.
I've talked to surgeons and they stay away from the nose. You like it?
I like it. It's one of my favorite things to do. I mean, look at the bump on her nose in the before picture, Randy. I mean, her nose has the right size, but the shape is off. And in this lady, she had a breathing problem. Her nose was crooked on the inside, and that led to the bump on the outside. So we fixed her breathing, fixed her appearance, and made her look much younger, actually, with the operation.
It really does.
It really does.
And it's a pretty look as well.
Yeah. Now, sometimes, and this is another example, sometimes patients come in for other operations, and we focus on the nose because in this lady's instance, she wanted to look younger. I mean, take a look at this lady's nose, okay? She comes in actually for a facelift, and she wants to look younger. And this is an example of doing something else to make them look younger besides what they really want, because we know what we can do to make their appearance better. And in this situation, we did a facelift on the lady. If you look at her in her after photograph, she had a facelift and a chin implant, but she also had her nose done as well. And I would say about 25% of patients who come in for facial rejuvenation surgery have something done to refine their nose because it makes them look younger. And hey, your nose grows as you get older.
So as you get older,
your nose grows.
The tip is starting to drop.
It drops.
What, do you just lift it a little bit?
Well, it's a combination of refining the cartilage, removing some cartilage, and remodeling some cartilage. You try to remove as little as possible to make the nose look more natural. Now here's another example, Randy, of nose surgery and rhinoplasty surgery. This is an interesting little patient. If you look at her nose, she comes into the office, her nose is very crooked and bent. And this lady actually was involved in an automobile accident. And she told me, she said, you know something, every time I get up in the morning and I brush my teeth and I look at my nose, I look at that crooked nose and it reminds me of that accident. It brings back that,
is that right?
It's kind of an anniversary reaction, we call it in medicine, where certain things bring forth that whole feeling of what they felt when they went through the accident. And so by refining her nose, she not only looks better, she not only breathes better, but it makes her mind basically forget the accident.
Now you said that after some of these minor surgeries, like a nose,
right,
these people become much more positive, more
well, yeah,
outgoing.
I mean, yeah, they feel much better about themselves. I mean, we've realized this in cosmetic surgery forever. You know, and now that surgery has become more popular, we see more patients, and we see these life-changing experiences, and all doctors who do the surgery recognize it, that it does change people's lives. And you know, it used to be when people came in to change their appearance or improve their appearance, you want to have a psychological test to see if they were okay.
Okay.
I mean, it basically was the psychiatrist would see them first, then you would do their surgery.
They used to do this?
Oh, yeah.
Okay.
Because, you know, they say, well, you know, maybe they're a little crazy for wanting to change their appearance. But we realize now that we can do these operations with a minimal amount of downtime, very predictable, and we can improve people.
What do you say to the patient watching this? They're not happy with their nose, but for whatever reason they're afraid, or they have a tough time doing something about it.
Well, I think that it is difficult for some people because you know, when you finally make that decision, you're going to make that change. It comes a lot easier. It flows, so to speak. But you have to go to a doctor who knows what they're doing, of course, and you have to basically receive a certain amount of inspiration from what he tells you and a certain degree of comfort for what he says. And trust. I mean, that's the most important thing. And I mean, I want people to trust me. I want people to be confident that I can do what I can do. And, you know, I never do anything that I wouldn't do on my own family. That's my rule. I mean, if I would do it on my own family, I would do it on a patient. Okay. And I mean, you know, I stick to that all the time. And I won't do something just to do it. I'll do it if I know it's going to come out good.
Are there ever patients that go to you and say, this is what I need, Dr. Elam? They kind of self-diagnose what they want, and you say, no, I don't see it that way.
Well, I do say no sometimes, but you'd be surprised at the degree of sophistication now.
Is that right?
In the general public, because they've seen a lot of these shows, they understand a lot more about the surgery, and they're a lot more aware of what can be done.
So they know what they want now.
Oh, I mean, you know, the internet and everything else has really improved people's understanding of what can be done. And I think that's why there's such a boom in cosmetic surgery today, is people have a much better feeling about it with knowledge. And knowledge is power. You know that.
Now, I talked to your office. Are people still traveling? They say they're traveling from all over the country to see you?
Well, they do, and we do have a certain clientele that come in, and Newport Beach is a great area. They can go shopping. The husbands can play golf,
right.
and so it is nice. I mean, but we see people from all over the United States, all over California, and all over the neighborhood. I mean, it's not just for the rich and famous patient anymore.
So everyday people are doing this.
Everyday people, and you know, the working class people, the secretaries, the loan officers at escrow companies. I mean, these people are the people that are the bread and butter of what we do.
Okay, we're going to take a quick break. We come back, some of your full facelift photos, some necks, and also some liposuction.
Good.
After that. You're watching The Wellness Hour. We're here with cosmetic surgeon Dr. Elam. We'll be right back.
Hi, I'm Dr. Bill Dorfman, the dentist from Extreme Makeover. I know a lot of people worry about taking care of bad breath.
I'm a mint popper.
I'm a rinser.
I'm a gum chewer.
That's why I recommend BreathRx, not only to my patients, but to everybody I know. Only BreathRx has Zytex, which eliminates bacteria, neutralizes odor, and it's alcohol-free. It's clinically proven to stop bad breath before it starts.
It's dentist recommended.
Get real fresh breath with BreathRx.
Now get the breath freshening power of Zytex in BreathRx gum and mints. Works fast, keeps working for hours.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in cosmetic surgery? With us we have Dr. Michael Elam. He is a diplomat of the American Board of Cosmetic Surgery. And okay, so for people just tuning in, we're talking about facial rejuvenation today.
Right.
You showed us a lot of photos. Give us a bit of a recap. What you're trying to accomplish when you look at the face.
Well, initially we talked about doing brow lifts and doing repositioning of tissue. And one of the things I want to talk about, I want to show this patient again.
Okay.
And really one of the things I want you to focus on is see her face, how thin it looks. And in rejuvenation surgery now, we're adding volume back into the patient.
So she's an athlete, you said.
She's an athlete. She's lost a lot of weight. She trains constantly. She's a personal trainer. So we do two things. We've changed the volume. We lift the brow. We reposition the mid-face. But we add fat, which she's lost in her face after she had the birth of 2 children, back into her face and made her face more full. I mean,
so where did you add
right into her cheekbone area.
Okay.
And then the other thing we did to improve her volume is we reduced her profile in her nose. In other words, we refined her nose. So we changed the volume in 2 respects. We reduced the prominence of her nose, and we added volume into her mid-face. And that's why she looks pretty now.
So it's actually fat.
It's fat.
She went from kind of a skeletal look to...
I think we feminized her.
That's right. A bit of a more masculine look before.
Right. We feminized her.
Yeah.
And I think a combination of softening her by doing the surgery on her and adding some volume back into her face made a huge difference.
Is that common? You're doing a lot of that combination of procedures?
I do a lot of that. When I do the endoscopic brow lift surgery, I do a lot of fat transfer in younger patients.
A lot of volume in the face.
A lot of volume in the face. Now, this is a very interesting patient, Randy, I brought to show you. This is a good example of facial rejuvenation surgery. Look at this lady's before pictures. Look at the wrinkles on her face. So
what's going on there? I mean, when you look at her on the console,
her brow has dropped down, her eyelids are heavy, and she has a lot of skin above her eyelids, and her face is wrinkled, and her neck is all wrinkled. And the thing that's interesting about this patient is she came in with her daughter. Her daughter actually brought her in and said, "Mom, I want you to have a facelift. To pay for it." This lady's a school teacher.
Okay.
Wasn't in her budget, wasn't in her plan. And I got a photograph the other day from them. She was on vacation with her children. They were down in Costa Rica. She sent me a photograph of all of them together, 3 generations. And they said, try to pick out the grandmother in this photograph. And you couldn't. They all look like sisters. Now look at the before picture, Randy. I mean, look at the neck area in particular. Look at the wrinkles on her neck, and look at the sagginess of the skin and the muscles. And look at the after picture. I mean, most of that's gone.
Did you laser that? What'd you do?
No, you just reposition the muscles of the neck, and you reposition the skin and tighten the skin. It's a traditional facelift operation.
So full facelift.
Full facelift.
Okay. Very natural look.
Very natural look.
Now,
72.
she lost at least 15, 20 years.
At least 15 or 20 years. And you know something? She feels so much better about herself. It's just to me, when she walks in the office, everybody just smiles. Now here's another example, Randy, I want to show you. This is a lady that comes into me, and she comes in at a relatively early age, about 46, and look at her face. I mean, her face, around her eyes, she's got a little extra skin, she's got some bagginess and some fullness, and her neck, she's got these folds and wrinkles under her neck area here. And she told me, she said, you know, my daughter's going to get married, and I'm going to basically be on the coffee table for the rest of my life in that photo album. And I don't want to look like an old lady anymore. And so she had a facelift about a month before her daughter's wedding, and basically because she realized in photographs she didn't look the way she felt. And now look at the after picture. Here's what we had to do. We had to reposition the brow, we had to address the skin over the eyelids, and we had to reposition the facial area and the neck area. I mean, look at her neck. All those wrinkles and folds are gone. Huge difference.
She looked, I mean, it almost could be a mother-daughter situation.
It almost could
here.
be. And she, like she said, I wasn't going to look like an old lady in that book anymore. I wanted to look like a young woman like I felt.
For her daughter's wedding.
For her daughter's wedding.
Do you find that a lot of people, what gets them to do something about their appearance is some event in their life?
Pictures. When you don't like the way you look in pictures, when you look in the mirror and you look at yourself, you always look 10 years younger. Just like the camera in the TV studio makes you look 10 pounds heavier.
Okay.
When you look at yourself in the mirror, you look 10 years younger. When you start looking at pictures and you don't like the way those pictures look, that's when people come in and have surgery. And I've had people come in with actual photographs that they've been given that say, I don't want to look like this anymore. Because when you look at your own, look through your own eyes in the mirror, you don't look at yourself in the same way.
I guess you just see the front
view.
Well,
we all have rose-colored lenses on when we look at ourselves in the mirror.
We have time for a few more.
Okay, I have another one, Randy. This lady comes into me, she's 68 years old, and if you look at her, she looks in the before picture, she does look her age.
She's a healthy looking woman, though.
But she looks her age, and she says to me, she says, you know, Doc, I've been lying about my age ever since I was 50 years old. I work in a bank, and I think they're going to retire me if they find out I'm 68. Just give me 3 more years. Make me look a little younger.
This is what they say. I mean, this is what you hear.
And I mean, look, older people are being replaced constantly by younger people. And so what we did is we did a brow lift on her, and I did a face peel on her, much the same as I did on Phyllis Diller. And I mean, we gave her 3 more years. Now, when we put these photographs side by side, Randy, look at the difference. She looks much, much better. She looks like a younger version of herself.
Look vibrant.
Vibrant and alive and rejuvenated. And that's what it's all about. Let me show you another example, Randy. This lady comes into me, and her major complaint was she didn't like the vertical lines around her mouth. But look at her photograph. She has big, heavy jowls. She's got a heavy face. She's got sad eyes. And you can see the vertical lines, but it's kind of the tip of the iceberg.
The jowls.
So, yeah,
I mean, an easy one to take care of?
Well, no, not an easy one. You have to do a facelift, but it's treatable. But I convinced her, I said, let me tell you something. We can improve your appearance. We can erase some of those vertical lines, but let's do a facelift on you. And finally, after we did a computer image on her, showed her what she can look like. Look at the after picture.
Right. She went from sad to happy.
I mean, unbelievable.
Her eyes, to me, make a huge difference, but I guess her lower face.
But her lower face was the big example.
When you look at the lower face, yeah, it's a big difference.
Unbelievable. When you look at her neck and what was done, she had liposuction on her face and liposuction on her neck. What a difference. Now, here's a male patient. If you look at this patient in the pre-op photograph, he's got low brows. He's got some bagginess around his eyes, and he has a weak chin. And a weak chin in certain civilizations and certain cultures is assigned to weak intelligence or low intelligence. And males with strong chins look smarter and look more intelligent.
Okay.
So, I mean, the weak chin really bothered him a lot. And so we did a brow lift on this patient. We did an upper lid blepharoplasty.
And where do you hide those incisions?
Well, that's the great thing about the endoscope. Because you're not taking out any scalp or any skin and not really taking any hair out, you can make the incisions in the hair, even if it's thin like this man, and you can actually hide those incisions. You hardly even see them after a couple of months.
Okay, so a little skin over his eyes.
A little skin over his eyes, a little fat from below his eyelids, and a chin implant. And the chin implant made a huge difference in this patient. A huge difference.
And you really can't see that, you know, that he has a big chin. It just looks like a regular guy.
It fits his face now.
But he looks much fresher and
much
happier.
more balanced. Much more balanced.
Okay. We're completely out of time.
Well, I have one more example.
Good.
You know, we talked about liposuction, and being the past president of the American Society of Liposuction, you know, being one of the founding members.
One of the first
guys ever to do the operation. It's one of my babies. And, you know, today we treat different patients. We treat athletes. We treat people with minimal fat deposits. And look at this lady. Most people would be very happy with her body.
It's a great body.
She's very unhappy. You know, she doesn't have what we call a figure fold. She can still wear a bathing suit, but she's unhappy about the fat deposits.
So her buttocks.
Her buttocks.
A little large, I guess.
A little large, a little bit on her stomach, a little bit on her thighs, a little bit on her arms.
Isn't that a tricky area, though?
Well, it's very, very tricky. But using very tiny cannulas, using tumescent technique, you can treat these types of patients. These are the most difficult patients to treat because they won't accept any imperfections.
So her arms.
Her arms.
She had arm problems.
She had arm
little
problems.
Abs.
Little abs, little thigh, little buttock. And I mean, you know, it takes a lot more time to do a patient like this because you have to use a very, very tiny instrument.
Okay.
But you can treat people like this today and make them very, very happy.
Let's take a look at the after.
Look at that.
Huge difference. Now very athletic buttocks.
Unbelievable. And she feels so much better about herself. So much better about herself.
So what do you do to the thighs? I mean, do you go all the way around?
Well, the most important thing is you have to treat the patient circumferentially. You have to go around the thigh. You have to go around the abdomen. And when people come in and want their abdomen done, you have to do their flanks as well, because the body is circumferential. It's round, and the fat has to be cored out around the body. And that's the thing we understand now about lipo that in the early days people didn't.
Do you have patients, female patients, that avoid wearing skirts because of maybe the bigger ankles?
Well, we have what we call patients with figure faults, and a figure fault is a defect or a problem a patient has that forces them to change the way they behave, forces them to avoid social situations, forces them to wear certain types of clothing. I mean, I had a patient one time that she came in, we did her ankles. One of the first patients treated in America that had her ankles done, and her nickname was Boots. She had 52 pairs of boots, and the reason why is she wouldn't show her legs to anyone. And we did them, and we took out 2,000 cc's, and she was one of the happiest people I've ever seen.
Clean up those ankles. What about the knobby knees?
Same thing. Knees are great. Arms are great. I mean, anywhere you have it, it's pretty much where it collects, you can take it out. Okay. If the skin elasticity is good, and the patient has a good muscle tone, and they're young enough, you can just about treat anyone with lipo.
Final message, and we are out of time. Patient out there, they're watching this, and sometimes people have a tough time doing nice things for themselves. They're watching this, they're not happy with their appearance, specifically their face. Where do they start?
Well, I think the most important thing is to go to someone, a plastic or cosmetic surgeon with a good reputation, somebody who basically has a long standing in the community, who's done a lot of surgery, and really basically investigate what can be done. I mean, I would say, you know, if you're unhappy, don't sit there and be unhappy. Come in and let us go through an analysis with you, put you on the facial computer, do a computer analysis.
So find out your options.
Find out your options and see what can be done. I mean, believe me, it's a lot more affordable than you think it is, and it's a lot more predictable than it's ever been. You know, people should do some research. You know, you can go on the internet, look at my website. We have a lot of information. We show a lot of before and after pictures.
So you still see, I mean, all the patients on the consults?
I see everyone, and I do all the consultations myself. I meet with the patient one-on-one. I do all the surgery myself. I put every single stitch in. I take every stitch out.
Great. Where are you doing the surgeries?
In my surgery center in Newport Beach. We're fully accredited and licensed by the state of California. We have a great surgical team, a board-certified anesthesiologist, and we do this every day.
What do you like most about what you do?
Changing people's lives, making them feel better about themselves.
Great. I want to thank you for coming on the show. It's always a pleasure
Thank you, Randy.
to have you on the show.
Thank you very much.
Great. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this program again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.